Hey, everybody. Welcome to another episode of the Global Health Impact Network podcast. Our host today is none other than Bob Sweeney. Bob, it's a pleasure to have you back.
Thank you very much, Martyn. This is Bob Sweeney. I'm one of the founding principals of Global Health Impact Fund and Global Health Impact Network. And as you know, if you've watched any of the earlier versions of this podcast series, what we're doing here is introducing key stakeholders in the global health enterprise or the global health organization. Today, we have a very exciting and interesting company CEO, Arup Burman.
Hey, Bob. Great to see you.
Good morning. Can you begin, Arup, by telling us a little bit about you, your background, and how you got to where you are now?
Sure. I'm a critical care physician, 20 years of practice, taking me between Stanford, UCSF, Children's Oakland, and Kaiser. I'm former medical director of the ICU at UCSF Children's, where I was also director of transport access and outreach. My journey into healthcare began long ago when I was just a little kid. I had a younger sister who was born with congenital heart disease, 4 years younger than me. And when I was 8, she was taken into what should have been a routine final surgery. And sadly, she died. She died in the OR. And that for me was really one of the major milestones or a life, changing or directing experience, in that was my driver for ultimately going into medicine, going into pediatrics, going into critical care, and ultimately taking care of children with heart disease. But then going through my career in those 20 years across these different institutions, they're really excellent places. But in every one of those, I'd seen patients die from preventable mistakes made by well-intentioned, hardworking, well-educated staff who simply could not pull the information they needed when they needed it. And at UCSF, I would sit on these system-wide committees, root cause analysis, where we would look at what was underlying some major, medical error or medical event. And invariably, it would come down to, we knew that as an organization, but now we have to go after the fact back and teach our staff back up. And that was, here we were, 40 years after my sister had passed away, and the same things were still happening. And at the same time, healthcare complexity was growing exponentially. The burden on our front lines was getting even heavier. And in parallel, in the consumer space, we saw the rise of these types of technologies. Consumer technology, mobile technology serve to be able to enable us, to empower us, to equip us with what we needed to be happier, to be more efficient, to be better connected, to do our jobs better. And we asked, why can't we have the same in healthcare where the stakes are so much higher? Why can't we support our frontline staff in the same way? And that was the impetus for what is Elemeno Health.
How did you get to what you're doing today with that?
Yeah. So, when we talk about that contrast of what was going on in the consumer space, and what was going on in the healthcare space. And when we looked at the greatest manifestation of technology en masse to the people who actually deliver care, that was the electronic healthcare record. A lot of great stuff with that, a lot of data. But the reality is we've created the most expensive clerical workforce in the history of this planet. It is full of force functions, the stick, click here, click here, click here. Whereas the people who've gone into medicine have gone in because they like to care for people. It's about that human touch. It's about that interaction between the doctor and the patient, between the nurse and the patient. And what we thrive on is that gratitude, that thank you from our patients. So how could we go back, instead of forcing our staff to do more, how could we enable them? And that's what Elemeno is about. We talked about that mountain or that wave of healthcare complexity that's just growing and growing and growing, whether it's all the different pathways, the devices, the equipment, the drugs. There's so much coming at people. And we still have this expectation that the nurse is supposed to have mastered everything. There's no way. And that's why when you go to the hospital, you see what nurse A does and nurse B does and what nurse C does. It's all a little bit different because it's hard for them to have mastered it all. So what we said is, how are we training and supporting our frontline teams, the people who actually deliver care? What we're still doing are binders and flyers and emails and dumping all these documents in SharePoint. And then we're doing in-person trainings. In-person means in one ear and out the other. It's all non-contextual. And when we look at how does our workforce learn today? Everybody goes to Google, they go to YouTube, they're looking for the bite-sized nugget, giving me something in context in the moment when I need it. So we brought all of this together. What we are, you can think of this as an enterprise solution for department-based issues. We're a B2B, cloud-based software and service. We're built on Amazon Web Services. We have no protected health information. What we do is help those department leaders. So if I'm an ICU educator, manager, medical director, to take content that would otherwise be living in those analog places, like the binders and the flyers, or thrown into places like emails or Dropbox, where God knows if you can find it, and if you find it, can you even digest it? We transform that content into bite-sized nuggets. It's short, interactive decision guides, concise how-to video with subtitles, less than 3 minutes long, or short bits of text. And we bring together both training and your team communication, your updates, recognition and gratitude, all shared for your team in one place, right here on your mobile device. Gated for your institution, customized for each one of your departments. So now if I'm a department leader, I can give my staff a continually updated playbook in their pocket, whether it's on the mobile device, or it's on the desktop. And on the back end, I can track who's looking at what. I've got 150 nurses. I know my 100 who are engaged and my 50 who are not. And I can track from them what they like, what they don't like. I can track from them what they're looking for and they can't find and what they're asking for. So now for the first time as a manager, I get real data in real time to know what's working and what's not, and to know what my staff's need is before they actually manifest as problems.
So, Arup, I've worked a long time with health organizations and physicians. One of the things I've noted about hospitals in my own experience is how difficult it is to get anybody's attention and to get anything going. How do you get a beachhead in one of these places so that you can get started? It strikes me as that's very difficult.
Healthcare is inherently risk averse. We think back to the Hippocratic Oath: first, do no harm. That's what it's all about. And what that means is that nobody wants to go first. Nobody wants to try something new. And that's why healthcare is so far behind every other vertical, maybe except legal, when it comes to tech. They don't want to move fast. They're always looking around to who is already doing this. So getting that first toehold is hard. But once you have it and you have proof points, we're able to show that when a client implements Elemeno, they're able to take their key processes and actually implement them at scale and get the results they want. And when they get the results they want to share it and they want to talk about it. And that gives us more credibility as well. But how do we get that first toehold at each place? We're a land and expand model. That is, since we are a cloud solution, we require no IT support. We can actually go to enterprise without IT. They may just give us a check off that, hey, you meet our security clearance. That's it. We're done. So that means that we can land in one unit, like emergency department, an ICU, an operating room, or high-risk maternity. These are very highly respected units in the hospital because they are full of high-risk, low-frequency practices. The risk is high. And when we show that we're able to empower those leaders and be able to drive outcomes in their units, they then evangelize our product across the institution. And the other department leaders say, wait, hey, if the ED is using this working well, why don't we do it too? And as each unit comes on, they start sharing content with each other. And that builds a network effect. So when each one comes on, it's not like they're just about their own world. They're starting to leverage the connected effect, the network effect of everybody else in their organization.
So this seems like a very bottom-up kind of driven process, as opposed
Absolutely.
to top-down.
It is bottom up. And that actually goes back, Bob, to our origins. All the larger practices, pretty much for the last 20 plus years, we've been in-house for call. That means as an attending, you're there at the bedside, not just Monday through Friday on business hours, but you're there on nights, you're on weekends, you're on holidays. So that allows us to develop really a deep empathy for what's happening at the bedside, a deep empathy for what's going on with our nurses, and to see how much has been put upon them. And so we actually developed a solution with nurses, with respiratory therapists, with young doctors at the bedside about what is it that you need that will work for you to support you in the moment. So truly, yes, we are a bottom-up solution. We're one that is developed by the people who are feeling the pain, not about somebody on the outside saying, hey, come and use this.
I would imagine that the appearance of the COVID pandemic may have created some demand for what you're doing, or may have created opportunities for you to expand. Can you talk about that?
Yeah, so it's been interesting. COVID has worked kind of a double-edged sword, if you will. It has underscored more than ever the need to be able to quickly disseminate information to your team in a manner that is both accessible and digestible. Now, in doing that, so if we look at one of our marquee clients when it comes to COVID, that's the emergency department at UCSF. This department is one of the national leaders in critical care, I'm sorry, in emergency care, and they are also at the forefront of managing COVID. And so what they said is that we've got so many legacy IT systems to be able to drive information, but when we need to move so quickly, we need something more. And so there they leveraged Elemeno, and we became key for them in driving COVID communication. And then they took their COVID practices that they wanted to share, and other hospitals who adopted Elemeno, instead of starting from zero, were able to grab practices that UCSF ED was using, and then they were able to approve that for their organization or modify it to fit their organization and go. And so UCSF was not only using this to drive COVID communication within their ED, they were using this to support other emergency departments that were a lot more resource constrained. So allowing their knowledge, their expertise to scale and make a much broader impact to staff and patients around the country and even some worldwide. So that's a way that here in this crisis, our need has been underscored, and we've been able to leverage it for growth. On the other hand, in the midst of COVID, everybody's revenues crashed. And
Right.
they're like, hey, I can't think of purchasing anything new. And most healthcare institutions said, I realize there's a big problem, but instead of looking to ways to change, they hunkered down and said, I'm not going to listen to anything on the outside.
Right.
I'm going to fall back to all of my own emergency readiness solutions. I can't look at anything new right now. So that was the contrast. Is it really the forward-thinking institution, or is it the one that is a little more scared and just falling back to what they have? That's probably the majority of institutions in this country fell that way. That being said, as they've started to emerge from COVID, they understand more than ever, and they've felt the pain of not having something that is agile and fast. And then they've come back to say that, hey, maybe now that I've got a little bit more breathing room, let me look at what I can do here with you so I can be better prepared for the future.
As an enterprise, how are you doing financially? How is your growth rate? Tell us a little bit about the firm and where do you want it to go over the next several years?
While I was working full-time at UCSF, we created a prototype on Salesforce, had some initial proof points, spun it off as a company, and then recoded on AWS to allow us something that was easy to sell directly and scale. Our first sale was in 2017. We've steadily grown since then. We're at 1.2, a little over 1.2 million ARR right now. Importantly, we have no churn. All of our subscribing clients are renewing and or expanding. And so that land and expand model has worked, and they are sharing this solution with others of their friends, their partners, their system hospitals, allowing us additional avenues for growth. With the business itself, we're looking to get to close to 2 million ARR by the end of this year, and then accelerating up our sales from there. Our sales have historically been one-to-one, meaning that we're going out and we're selling directly to each client. But now we've just launched our first partnership. It's with the National Perinatal Information Center, based out of Providence, Rhode Island. So, somebody cross country from us. Been around 30 years. They are a national leader in that kind of maternal neonate care, representing 90 hospitals around the country. And they've been great historically in finding out the gaps on where each hospital needs to do better, and then being able to start the education to close the gap. But what their clients have said is, we need a way to take that information and really drive it at the front lines and track it. That's where we come in. So we're partnering with them, and through this model are going out not only to their members, but wonderfully, NPIC has said, hey, a lot of our neonatal and maternal best practices, we're going to make them Elemenoized, and we're going to make it available to other Elemeno clients across the country, even if they have nothing to do with NPIC. And that's, fundamental to what we do, is we are driving sharing between hospitals. We're creating community so that everyone can learn from each other. We don't reinvent the wheel, and we accelerate the spread of best practices nationwide. So that takes us in a model going from selling from one-to-one to be able to leverage partners to sell from one to many. We've also just launched, and the press should be coming out soon, on a partnership with one of the largest state hospital associations in the United States. So going out to their members in a similar manner. And we've got several more of these types of relationships that are in our pipeline for that growth acceleration. And where is it, that we ultimately want to go? Yeah. Healthcare is for everyone. Everyone has a right to the best healthcare possible. And our mission is to be able to radically reduce medical errors, to be able to democratize access to best practices, and to be able to enable every healthcare provider to deliver the best care possible to every life they touch. And what that, we shared a little bit on COVID, where we were able to take expertise from an institution like Ucsf and facilitate the faculty there to be able to share it with others in the developing world. So as our cloud community grows, you can imagine there the ability to be able to share content from here to others in the developing world, where for many, the biggest piece of technology, the most complex technology that they have in their hospital is that mobile device that they're carrying in their pocket. To be able to leverage that, to be able to drive sharing from the resource rich to the resource constrained, to be able to connect us as a community. That is my big picture vision. And if we do that, the tragedy that started all of this from my sister's passing so many years ago can make a difference to millions, billions of people worldwide.
Well, that's a very compelling agenda, Arup, and it's very moving to hear you present it that way. So I wish you the best on that. Have I left anything else out here that you want to talk about?
When we think about healthcare is a team sport. It's a team endeavor. It's all about people, and it's about people working together. Whether you are working together at the bedside in the ICU, you're working together in the clinic, or you are working together as you hand off on each step of the care continuum, going from ambulatory into acute care, into skilled nursing, into home care. So it's about people and it's about communication. And so critical to that is that flow of information from one to another. And critical to that is the empathy for what one another is doing. And so we are strong believers that medicine is not delivered by doctors or nurses or therapists or pharmacists. It's by all of us together. And to that end, we're strong believers in transparency. That through Elemeno, we're not a doctor solution or a nurse solution or a pharmacist solution, we're a team solution. So the nursing practice is visible to the doctor, is visible to the pharmacist. The doctor practice is visible to the MA, to the nurse's aide. So that each of us can see what each one of us needs to do. We can anticipate, we can support each other, we can hold each other accountable, we can work together to make each one of us better. So that's, I want to really drive home that we are a team-based application. And that philosophy of team extends into our company itself. So our leadership includes doctors and nurses. When we look at, my right hand in this company, Scott Cohen. Scott, he's an MHA. His experience is on the business end. We're building a business, and that business needs business expertise. Scott's had successful exits with Healthion and with Athena Health, where he started there as like VP number, he was VP number 4, employee number 210, grew them to over 6,000 employees and $1.1 billion in revenue. So he brings that side of the experience. And Scott said when he left that job, he didn't need another job, but he was looking for a company that really knew what they were doing, the problem that they were solving, and it was a problem that really made a difference. And the problem that we were tackling here, that gap between what we know as an organization and what we actually do at the bedside, that problem is one that he had seen time and again throughout his career at Athena. So we're bringing in that type of business expertise. We look at our team of sales. We've got folks that have come from McKesson and from the healthcare world who know that type of sales have come in to be able to complement us. And when we look at product, our engineering and our product folks come from the space of gaming. It's about how to educate, or not how to engage people right there in the moment. Come from the world of Autodesk, about how to be able to enable the end user directly. So we focus intently on the user. And when we look at our team as well, we're 20 full time, but we span every generation from boomer to post-millennial. We span Democrats and Republicans. We span every race. We span every gender, every sexual orientation. It's about diversity on our team. And why is that diversity important to us? Because that diversity reflects the people we serve. I'm proud to say that we've got clients in blue states and in red states, and they all get along and they share practices with each other because we're all on the same mission to be able to deliver better care to our patients and to be able to do that as a lower cost.
Well, that's an inspirational overview, Arup, and I hope you can transmit it further because we certainly could use more of that in the world we live in today. Folks, this is Arup Roy Burman, CEO and founder of Elemeno Healthcare. Thank you for having joined us this morning, Arup.
Great. Thanks a lot, Bob. And for those interested in our mission, if you would like to learn more about our current raise, please reach out to me directly. And you can also find us on, we brought Start Engine into the mix as well, as we had several nurses, doctors who wanted to be a part, and we really wanted to open this up to a community of patients as well.
Perfect. Thank you so much, Bob and Arup. It's been a pleasure to have you both on. Ladies and gentlemen, I hope you enjoyed this conversation. Tune in next week for another amazing speaker. Thanks.
Sounds good.